A damning report released by the Public Protector has uncovered severe mismanagement at Dora Nginza Hospital in the Eastern Cape. According to the findings, the Provincial Health Department has violated a number of laws and operational regulations at the facility. The report, based on a 2024 site visit, highlights serious concerns, including inadequate security staff, a broken CCTV system, and a total breakdown in basic maternity ward security protocols. The report was released just days after 2 newborns were stolen from the hospital's maternity ward. Joining us now is the Public Protector, Advocate Kholeka Gcaleka. Thanks very much for your time. It's a pleasure having you on. And this is an issue that civil society groups have been decrying for the longest time, some 15 years, the state of Dora Nginza Hospital. What prompted your surprise visit? And just a note, that usually when these surprise visits happen, there is an advance team that is sent to sort of forewarn the hospital, but that's not how you conducted this visit.
What prompted this surprise visit is that if you recall that a few years back, around 2021, the Public Protector actually embarked on site visits into several hospitals in our country across all provinces. And we had actually later released a report into the state of the healthcare system in South Africa. And following that report, we realized that the Department of Health had done very little to implement the remedial actions of that report. Therefore, we were then doing spot visits into the hospitals, and we had received several tip-offs regarding the challenges of Dora Nginza. But also, we also got a report from Algoa FM after it had been reported that there were patients who were sitting on benches because the maternity ward was overcrowded. There was no linen or any hospital clothing. The kitchen was dilapidating. There was a shortage of healthcare workers, and that the maternity ward was the most affected in this respect. And then I embarked on the surprise visit to the hospital.
Yeah. And how shocked were you when you arrived there? Because, you talk about our colleagues who have been covering the story in the industry, and we've seen those videos, right, of pregnant women sitting on benches and on chairs for days on end. Some women have already given birth. They still don't have a bed. And we know that poses a huge risk for increased infection.
No, I mean, the situation was very shocking. And I think what was most shocking for me and the team was the denial of the hospital management of these conditions under which the patients had found themselves, but the conditions under which they too find themselves, because if you do not have sufficient working tools, there is insufficient staff, support staff to ensure that medical services run smoothly, then really we cannot say we adhere to the constitutional imperatives of access to health care for everyone, because the health services must be efficient and effective.
So your report, Advocate Gcaleka, also talks about the department failing to use the funds allocated for essential equipment in the hospital. And this is where it comes to constitutional issues, right? Because government departments can say they don't have the budget to implement particular measures effectively, but you found that they had the budget, but they weren't using it properly.
Indeed, we found that there was a challenge in planning and budgeting, not just in the past financial year, even in the previous financial year. Funds were actually returned back as a surplus to National Treasury. Yet, not just Dora Nginza, there are other hospitals in the Eastern Cape and other services that are required within the public healthcare sector, which are not being efficiently delivered.
In defense of the hospital management, perhaps, can we say that the absence of a district hospital means that Dora Nginza is filling a whole range of gaps in that part of the province? It is a clinic, it's a district hospital, it's a regional hospital, it's a maternity hospital. Essentially, this hospital is providing or expected to provide specialist services to that entire region of the Eastern Cape.
Most definitely. I mean, they provide tertiary hospital services, which is really not in line with the required prescripts. And we actually found that that was against the law. And basically, the overcrowding of patients directly accessing the hospital, it is part of a defense to the hospital staff, but it is definitely not to the province, because the province at least is supposed to put together a plan to ensure that the necessary dissemination of services happens. And we actually found that this is the case actually across the country with hospitals. When we conducted our site visit between 2020 and 2021, we also found that the Mthatha Hospital was in the same position, but also the fact that positions are not being filled. Everything is centralized to the province, and the weight of the work does become a lot for the province to process those vacancies, which includes vacancies of cleaners, of potters, which we believe that if a hospital is managed by a person at a level of a CEO, that person is earning at one of the highest levels of public servants in the country, and they should be in a position to manage a budget and be sufficiently skilled to be able to recruit their own staff at certain levels.
Yeah, and it's not just about mismanagement, right? When you work in the corporate world, mismanagement is one thing, but if it happens in a hospital, what it results in very likely is a loss of life. And we see it in the number of maternal deaths in the province as a whole, the Eastern Cape recording the second highest number of maternal deaths in the country. The statistics also show that both neonatal and early neonatal deaths at facilities in that metro have also risen year on year.
It is definitely a risk. Well, we've not done an investigation to determine what causes the deaths, but it is probably a contributory factor, and it is a high risk because when we had done the inspection in local, we were actually informed that the nurses and doctors are not able to immediately attend to a patient who's undergoing an emergency because of the fewer numbers of the healthcare practitioners.
Right. So does part of your report as the public protector recommend to the province that that part of the Eastern Cape needs a district hospital?
Most definitely, we do take remedial action. And I just want to emphasize, Michelle, that the public protector in this instance has taken remedial action in line with its powers in the Constitution. And remedial action is actually binding unless it is set aside by a court of law or there's an interdict, which actually means that it is mandatory for the Department of Health to actually implement and start to put together a plan and actually funds to establishing a district hospital which will feed into Dora Nginza and assist people within that particular district.
So that's obviously a long-term recommendation. In the sort of immediate to medium term, what are the measures that the public protector will recommend?
What we've put as remedial action is that they have to fill the vacancies that are there. And secondly, they need to ensure that there is sufficient medical equipment. So there has to be a reprioritization of the budget, considering that they've actually returned the funds that they had left for this financial year, which was not the first time, in fact, that they had done that. So they've had sufficient time to prioritize and to be able to plan. But they are unfortunately now under pressure because of the timelines which we have now put in place because of the dire situation which has been left unattended.
Yeah, I mean, the patients who use Dora Nginza Hospital, the nurses, the staff who work there, I'm sure they would be appalled to think that any money that's allocated to the hospital would be sent back to Treasury, just given the state in which they work, never mind the state that patients have to deal with.
Well, the money was not directly allocated to the hospital, but it was allocated for healthcare services in the province. So it was upon those who are responsible for the budget, even at provincial level, who actually manage the hospital to ensure that the hospital is being prioritized considering the challenges that it faces.
So will the public protector conduct another visit in the near future? How do the follow-ups work in terms of the functioning of the hospital?
Most definitely we do. What we actually do after we've issued remedial action, we monitor the implementation of our remedial action, and that includes doing spot visits to the hospital, receiving reports from the province. We are expecting a report from the HOD, who will be informing us of the progress of the implementation. But we do monitor it ourselves against the report, because we want to satisfy ourselves that our remedial actions are actually impactful and that the people on the ground actually feel the difference.
Certainly. The Public Protector, Advocate Kholeka Gcaleka, thanks very much for joining us this afternoon.